many of you, if you're healthcare professionals, you'll be very familiar with the 5 rights of medication, which I think now is 7 rights. But I wanted to frame so that you've got a sort of a key takeaway message that you can sort of easily remember. So I'm just trying to frame what's important here for successful implementation around the 5 rights. So I'll be talking about the right reason, the right evidence, the right people, the right environment, and the right process. So the right reason, it really is about identifying the problem that is actually occurring. And there are a number of different ways in which this can be done. It can be that there might be a particular intervention that is used quite a lot, sort of very frequently in your clinical area, and you're wanting to make sure that it is because it's so frequent, that it is the best possible intervention to be used, it is aligned with best practice. Sometimes it can be things like if you've got poor outcomes, so for example, if you have high falls rates in your area, that might highlight to you as an area that is a problem area, and you want to try and reduce the number of falls within your area. So you might look at how you can, what best practices are around in falls prevention. They can also be driven by there being a national or local request. There could be new evidence that has come out, and that can be the driver for you as well. But it's important to be, when you're thinking about the reason that you're doing it, start thinking about what the benefits are in doing this project, because projects can, they do take a lot of time and people's energy. So you want to be making sure that you're using that time and people's energy efficiently, and that there is going to be a benefit to the patient and to the organisation as well. So the other right is making sure, so you've identified your area, you really want to make sure that you're using the right evidence to inform your practice there. And when you're looking at, what is the right evidence, you're wanting to be using evidence that has been developed using has a rigorous methodological process, that the quality of that evidence is considered to be high, and that those recommendations that are coming from that evidence, you're going to be able to apply them appropriately into your area. And so when I talk about the sort of, the appropriateness and the feasibility of the evidence, sort of what comes to mind is that, if you're in a setting where the evidence shows that a patient has come in and the best available thing is for them to have this scan done that uses this expensive high-tech piece of equipment, if you are in say a rural or remote or a low-resourced country, you might not have access to that particular resource, and therefore you're not going to be able to align your practices with that. So it's about identifying your topic area and then ensuring that you're following through with the evidence that is of high standard and is appropriate for your setting. And for us here at JBI, we have our audit criteria that we use, or what we use to develop compare our best practices against, are informed by our JBI evidence summaries. So I've just put up an example of what one looks like here. This is an example of a hand hygiene evidence summary. It's available on our JBI website via the COVID-19 special collection. And so our evidence summaries are developed, there is a sort of a short, succinct summary of the evidence, but they are developed using a rigorous process of a search, critical appraisal, development of best practice recommendations that align back to the evidence. And we have a 2-stage peer review with experts in the field to ensure that that's appropriate as well. And from our recommendations, this is what we use to develop our audit criteria, and that sort of is our quality indicator, or our standard for best practice. So when you're thinking about the developing, obtaining the evidence for your area, you're wanting to be sure that you're using not just a single study and a recommendation from a single study that perhaps wasn't done very well. You really are wanting to make sure that there is the methods behind it to ensure the quality is there. And then, all importantly, I mean, implementation cannot be done without people. So, and I think there are plenty of examples out there of needing to have the right people involved. And so when you've got the right people involved, you are more likely to have a successful project. So I've tried to just sort of categorize them here into sort of the different types of roles of people. And really, when you're doing an implementation project, it's really important that you involve people at all different levels. So this is at the local level, you're getting clinicians and champions with you on the ward area that are going to actually be able to engage and really be a champion for you on this project. It's also about making sure that you've got the right people at an organisational level, as well as those policy and decision makers. And there's all different types of roles. When you read in the research, they can be called decision makers, the researchers, even involving with the researchers themselves. So they're the ones who are actually doing the research, developing what the best practice evidence is, making sure there are key facilitators as well. So you really need to be thinking about engaging with people that have the right skill sets to be able to help your project succeed. And then not only just the right people, but you want to make sure that they've got the right characteristics or qualities as well. And so I've got a few listed to the right of the screen. But for me, the most important one here is you're looking for people that can communicate well. Communication is one of the key aspects of a successful implementation project. You need to be able to people need to be able to communicate any changes that are made, have any voice, any opinions or concerns. So that's what you need to be looking for when you're looking for the right people there. So we've touched on the right reason, the right evidence, the right people, and you need to have the right environment. So this we're really looking for here is for successful implementation, you're looking to make sure that your environment, your context is ready to undergo this change process. So this is like about a readiness for change. And this is across all different levels. So here we talk about the local, organisational and external. It has also been referred to as the micro, meso and macro levels as well. So there might be some terms that you're familiar with here, but it's essentially looking at making sure that you've got the right structures in place to help for this project to succeed, that you've got the right leadership, that there's capacity for the change to be occurring. So it's really quite important that we are able to evaluate what our environment is before we get started, and it does allow us to try and succeed more successfully. So our last right for successful implementation is making sure that you adopt the right process. And what research has shown is that when implementation projects or change practice is likely to be more successful when you have followed a structured process as compared to an ad hoc kind of process where you just sort of make it up as you go along. So it is really important to focus here on, ensuring that you've got a clear process and people understand what their roles are within that process, that you're clear on what it is you're going to do, when you're going to do it. So the timing is of importance here. And also that your process embeds in some kind of evaluation as well. So it's not a matter of just saying this is how we should be doing it. You're actually going to be incorporating an evaluating the practice, learning from that as well. So we really need to be, it's essential then for us to, when we're going to think about selecting the right process, choosing the right process for us, the importance of understanding your environment and knowing the people that you're working with, so the right people in the right environment, they really should become really quite evident here, that you actually you need to have a really good understanding of those in order to be able to move forward with the right process.